An infodemic is a term coined which refers to too much information, including false or misleading information, in digital and physical environments. So many of you sitting here today work in organizations where you've had to deal with the very serious implication of infodemics, of misinformation, of disinformation, and hate speech. In humanitarian settings, there are potentially far-reaching implications for people most vulnerable and marginalized.
All false information is pollution. But while some of it is like litter, some is more like toxic waste. It can contaminate the online environment and poison society. Disinformation is false or misleading information that is spread to deliberately cause harm. Disinformation can also be used to create confusion about if it's even possible to know the truth at all. Those who create and spread disinformation wish to influence the way others think and act. Disinformation can be created by foreign governments, domestic organizations, or groups of individuals. It might be created to discredit a person or their message, reduce trust in democratic institutions such as media and government as a way to make citizens feel cynical or apathetic, promote false conspiracy theories that question the reality of true events, or influence the outcome of an election. Disinformation can start on message boards where individual trolls spread false rumors about people, events, and issues using social media. Or it can be created in troll factories where people are paid to make up articles that look like real news. Disinformation is designed to target our emotions, so we are more vulnerable to accepting it and sharing it with others. False stories and claims may also contain elements of truth to make the whole thing seem more believable. Photos and memes can help spread disinformation quickly because people think less critically about images than they do about words. The idea is to influence a conversation by promoting certain ideas or criticizing others. Once people see, share, and interact with these fake posts, they will become popular for real. Disinformation that is amplified in this way can attract the attention of legitimate news organizations. Journalists may report on the stories, spreading them further. A win for the trolls, who may want to mislead, confuse, or persuade you, and their motives may not be obvious. So what can you do about it?
Without further ado, our last session for today, Past is Prologue, Building Community Resilience to Combat Misinformation and Disinformation in Emergencies. This discussion will be led by Divya Pushkarna. Divya is MSF's Disinformation Advisor. In her role, she supports MSF's operational work by tackling elements such as rumors and accusations against MSF, attacks against staff, manipulated content, false information, and more. Divya, welcome to the stage along with your panelists.
I've been working on this for the past 1.5 years plus. And whenever I explain it to them, the concepts and the threats which it can bring, I often come across these notions that what happens online stays online, or these are future threats. But misinfo, disinfo have long been tools of manipulation, influence, sowing seeds of doubt and division. However, these terms became known to the common public during the COVID pandemic when the response teams started to witness challenges misinformation brought in front of them. From vaccine hesitancy to violence triggered by rumors, as humanitarian organization, we often see misinfo often leading to mistrust and tensions within communities. In a world where information shapes opinions and influences decisions, it has become even more important for all of us to work on building community resilience. Today, I'm honored to share this stage with our esteemed panel who have been working and researching on this topic for decades now. So our first panelist is Tina Purnath. She's the team lead for infodemic management in the unit for high impact events preparedness Department of Epidemic and Pandemic Preparedness and Prevention at the World Health Organization. For more than 25 years, her expertise has brought together health research, analysis, and policy making with an emphasis on digital health and health information systems. Our second panelist is Osama Manzar. He's a senior Ashoka Fellow who founded Digital Empowerment Foundation 20 years back in 2002 to ensure digital access and empowerment to the most marginalized people. And our third panelist is Shalini Joshi. She's Program Director for Training and Network at Midan, a global technology not-for-profit that builds softwares and initiatives to support fact-checkers, journalists, and researchers who work on tackling misinformation. And she's also the co-founder of Khabar Lahariya, which is India's only independent digital news network available to viewers in remote rural areas and small towns. Welcome, Tina, Osama, and Shalini, and thank you so much for joining us for this session. So I would like to start this session by discussing a little bit about misinformation and disinformation in the pre-pandemic time. And I would want to start with you, Shalini, because you closely work with fact-checkers, journalists, researchers, and even tech companies. So what it looked like in terms of disinfo related to health and other aspects, and what exactly changed and how it impacted the newsrooms or the researchers when COVID hit all of us.
Thanks, Divya. So I'm going to talk about some of the work that I've done with fact checkers, with journalists, with newsrooms, some of them working at the community level, and their experiences during the pandemic and also post the peak of the pandemic. So during the pandemic, as we all know, there was a very high demand for science and medical information that could quickly communicate complex topics to different audiences. There was confusion because it seemed like we were nowhere near reaching either a social or a medical endpoint to the pandemic. And the usual model for misleading information and the way in which people address misinformation is that there's misinformation, which, as Sana said, and as we saw in the video, is that there's false information that is spread unintentionally. So many times when we see information on closed messaging apps and on social media, and we share that, forward that information, we are actually spreading misinformation. And there's disinformation, which is false information that's spread with the intent of harm. So we certainly saw this during the pandemic, where there was the spread of false information. False information that exacerbates the spread of the virus. So, information about cures, information about causes, etc., of COVID. And what was challenging for newsrooms and fact-checking groups was that the body of knowledge around COVID was very limited, and it was evolving as scientists and epidemiologists were researching the virus. So the framework of misinformation and disinformation has a basic assumption that could not be applied in the case of COVID in the initial days of the pandemic. And the idea that there might be a ground truth somewhere at some point, this could not be applied in that situation where knowledge was still evolving and emerging. So my colleagues at Midan call this stage mid-information, where scientists are gaining clarity, but it's going to take time for scientific consensus to build and for public understanding to catch up. So mid-information is the sort of information crisis that happens when not all facts are known. And in that vacuum of knowledge, all kinds of rumors and conspiracies and misconceptions can emerge, which we, again, all of us saw during the pandemic. And we might define mid-information as informational ambiguity, which is based on scant or conflicting evidence, often about emerging scientific knowledge. So what did COVID change and what happened in newsrooms and in fact-checking groups? In many groups, it required journalists and fact-checkers to acquire new skills, and sometimes overnight they had to acquire these new skills. And as one journalist said, that it was a marathon because journalists had to take care of themselves, of their own physical and mental health, of their families, of their loved ones, and also recognize that when our attention to news might be destructive, and to remember that resolution to the pandemic would take time. So there was a lot of that happening. And often there was no data, or data was not validated or vetted, or it conflicted with other studies that were available. So at that time, Midan, the organization that I now work with, launched we launched a service called Health Desk and made every effort to provide health and science-related information that is accurate and that reflects the best available evidence at the time of publication of that information. And for many small and community-based newsrooms, translating health information and complex health information was challenging. So Health Desk was a service that was available to such newsrooms also. Many newsrooms invested in training their reporters and fact checkers on reporting on the pandemic, on health issues, and also invested in involving public health experts, sometimes also engaging with technology platforms to make sense of the emerging information. So all of that was happening during the pandemic, and I think that the way in which people were reporting on health, and especially small, under-resourced newsrooms, it was a very challenging phase for them.
Thank you, Shalini. I think when it comes to health misinformation, in the pre-pandemic era, Ebola epidemic gave us a glimpse of how lack of correct information or misinformation can negatively impact people's health-seeking behavior, and also at the same time create unsafe situations or conditions for health workers or humanitarian workers. So, Tina, because you work with World Health Organization and you also get to see the humanitarian side of misdisinformation, my next question is for you that over all these years, how have you seen this information disorder evolve, and what were those new challenges which we haven't discussed about yet that the the COVID pandemic brought to us, to the vulnerable people, to the health workers and humanitarian workers who were actually responding to emergencies?
Thank you, Divya, for this. Well, actually, WHO has been following how misinformation affects people that are impacted by emergencies, and also health workers now for quite a while. Actually, the founder of the WHO-hosted Africa Infodemic Response Alliance used to work at MSF addressing misinformation in emergencies globally. So we actually have a lot to learn from one another and our experiences. So early in the COVID-19 pandemic, actually the first people, among the first people that joined us at WHO in thinking and responding to the infodemic were MSF and from humanitarian and people from the humanitarian sector. So thank you. Your experiences and perspectives have been really critical in advancing also our work and thinking going forward. But to take a step back, so in the public health context, how is health impacted when a health is impacted in an emergency in a community? So one thing to remember is that the psychology of crisis means that we remember the first thing that we hear. we have trouble processing complex information. And we actively look for additional information. So this creates really a perfect storm for, one, the information overload, and also for the spread of questions and concerns, and searching for information that you can't find from credible sources, and then also for a spread of mis and disinformation. There's individual, family, community, health system, societal impacts of misinformation happening all at once. And that makes it really difficult to address. Now, before COVID, the people that knew this best in public health were people working in immunization. So vaccine misinformation has exploded in recent years. For example, one of the claim that autism is caused by vaccines was something that was was spurred by a retracted paper that was published in a scientific journal, The Lancet. And just to give you an example of the complexity of how information now spreads, for example, in the US state of Minnesota, there was an outbreak of measles in the Somali community. And because of this misinformation, this discredited doctor was actually spreading to the families there to warn them against vaccinating their children. But this spread from the Somali diaspora back to Somalia, and this was the first time that actually in Somalia the narratives, the misinformation regarding vaccines causing autism actually, and the concerns about this actually emerged also there. So really parents repeated this misinformation, and really the narratives and the connections that we have now globally are much more complex. And even if one works in a particular fragile setting, etc., the communities that we work with have cross national boundaries, not only the media itself, but also communities themselves. So the way that the information flows between communities is now much more quicker, and it can be much more devastating. And also in India, you've seen this in, for example, 2018, there was misinformation on WhatsApp that basically really severely affected the measles rubella campaign, and similar circulated then too. Now, why am I describing this? Is because outbreaks occur in places with weak health systems, and normally these areas also have compounded other situations and other types of situations where loss of trust is then more common. And this makes it more difficult for us who work in public health to really consider how the information environment affects not only our communications, but actually provision of health services or lack thereof, and then humanitarian emergencies. Why am I saying this? Because mistrust is an outgrowth of a perception that needs were not met. So that promises were broken and values were violated when we work in a community. This means that if we don't first address the questions and concerns that a community has, the needs they may have for services, then this actually opens the door for misinformation to fill in not only the information void, but also affect people's trust in the health workers, in the health system, in the health services. So all of this is actually even more acute in humanitarian setting, and I think colleagues at MSF and all of you who work there are familiar with this.
Absolutely, Dina, absolutely. And I would like to, before I proceed to the next question, pick on the point that how misinformation, disinformation takes advantage of the fears and the confusion which is present during an emergency, because either there is lack of information or someone is trying to take advantage of it and come up with narratives which are much more believable for people who are already dealing with a crisis. So when we generally look at and we try to research on misinformation, I feel it's equally important that we analyze that how the people who are consuming information, how they are actually doing it, how they are accessing internet. And with this, I would like to come to you, Osama, to ask that over 2 decades, you have seen that shift closely in how people are accessing internet, how they are consuming information. And according to you, do you think we really need to pull up our socks and do much more work on digital literacy in this age, or have we reached that optimal level already where people are cautious enough to understand what to believe in and what not to, and how to consume information responsibly?
So I want to take a little backseat that it looks like that we have a scenario where information consumers are less than information producers and the media. I was just looking at the number. We have about 1.2 billion mobile users, and 600 million users are smartphone users. And these are media in your hand. 897 TV channels, most of them Godi media, of course. 350 news channels, and I must say that they are hardly news channels. They are channels, and 80,000 newspapers, right? Now, all this number, top-down number, 1.2 billion, 600 million, has happened in the last 5 years, or let's say 10 years. But we haven't educated people how to use the media in the last 5 years. And the only people who have learned how to use the consumers to use information is the misinformation producers. They have understood the real human behavior, that how they use information which is given to them, so much so that I'm sure all of you would know, couple of years back, people used to say, WhatsApp pe aaya hoga to sach hi hoga. You know, if I have received it on a WhatsApp, it must be true. And I remember with WhatsApp, we had done a huge research project and found that 90% of the consumption of information in rural India was happening only through WhatsApp. And there was a difference between two half decades, is that there was a time when there was a connectivity, and there was a time with not connected population and connected population. Now the scenario is that unconnected population is as affected as the connected population, because there is one in the family or one in the neighborhood. So anything that comes as a misinformation is a spread as a rumor, and then further goes into belief or a faith. And it is designed in such a way that it plays on your illiteracy of the medium. And there is not a single curriculum anywhere in the school or college or university or among any strata of the society of media information literacy. There is nothing, and I'm 100%, I can challenge each one of us here sitting, is a misinformer. Because all of you who forward a message thinks that you have produced the message. Because you feel like getting a call saying, oh, you have forwarded this message, great. Either you are laughing, it's a joke, which is also on some kind of narrative, and you are one of that. Not a single of us have learned how to fact check. Fact check looks like as if that it requires a PhD degree to become a fact checker. Fact checker should be part of the parcel of every mobile ownership, but we don't know. So the issue is that, yes, I agree that media information literacy is gone by yesterday. We need to do it as SOS. It's not only about health per se, the way we perceive, but more so mental health. Misinformation, disinformation, online harassment, hate speech is a biggest mental health killer, and it is not recorded. It is not recorded how many nights I am not seeing because I am seeing something which is a disinformation or misinformation. but maybe it's a physical health that is being counted, whether my health is not good or bad. Most of the people are suffering from mental health problem because of the misinformation, hate speech, and there are many kinds. I mean, don't think that stand-up comedy is not a misinformation. You know, there can be. So culturally, how you are basically using history and changing and things like that is going into the narrative. And I don't believe that only rural India, who is less connected or half literate, is the only consumer of misinformation and propagating. But I think the most dangerous is that those misinformation producers are the most literate and educated people who have understood how does it function at a grassroots level. And those are the people who are doing it. And at the top of it, the reason why we are propagating too much is also because it is supported by political parties. There is no reason why we suffer so much and there is no action. It has, who has an interest in making misinformation? It's very simple to figure it out, very clearly. And those are the people who are not being, we are doing intellectual discussions, we are doing all kind of discussions, but nobody directly blames who is the real misinformation producer.
I completely agree with you on that point. And from what you have just explained, I want to pick up one quote, not connected but affected. Yeah. And I hear it from many people when we talk about research work, analysis into context and everything, that researchers often focus a lot on the content or the data which they find online, or they focus a lot on doing analysis on the audience which is connected to the internet, which is found online. Do you think that while we look into these narratives, while we work on such analysis, do we miss out on certain people? Certain people fall from gaps. Are there any gaps which are based on gender or communities? Like, what are we missing out on them? And if yes, then what can be done? And how can we come up with more inclusive models? And because I understand when we talk about offline listening, it's and we have discussed it a lot within us, me and Tina, that how hard it is to fetch data from offline sources. Therefore, we end up relying a lot on online research. But how can we be a little more inclusive in not leaving those people behind who are actually not connected online?
So one thing, I mean, I don't want to claim that it will be right, but what I have observed through the network that we have about 2,000 rural centers all over the country, and more than 60% of them are run by women. And we have done a program of how the consumption of information and dissemination happens. And we have found that the gender of misinformation and disinformation is male, not female.
If you can elaborate
so
a little.
What I'm saying is that the less the gender parity in terms of digital inclusion, the more the information production of misinformation. If you give a mobile or an information production in the hands of a woman, or the usage, it will always be more, more humane and more rightful, more factual. But not in, you will see most of the misinformation is produced in the factories which is owned and run by men, not women. And most of this information who are going at the last mile in terms of consumption is also happening mostly by men. So in fact, hum logon ne apne when we started working and giving digital inclusion, we started mostly to girls. And then we saw that most of the things that is happening is easily taking her out. That this is not related to us, this is related to job, this is related to earning more money, this is related to more education, and so on and so forth. But so as a media consumption, if it is hands of a woman, it's less, or I would say almost negligible in terms of side effect. I mean, that's what I would say. And therefore, most of the misinformation, disinformation, not only getting produced by the male gender, but also it gets more forwarded, more consumed in the same gender. I mean, I could be totally wrong, but this is across few thousand locations that we are working, and we have actually created a policy that if you want to work at a grassroots level with digital inclusion, give the mobile or a smartphone or a computer in the hands of a woman, you will have a better community around you.
That's quite an interesting insight. I think we can have like a full day of discussion on this, but
I have a research report also.
fantastic. We would love to hear more about that research. Coming to the initiatives and policies, I think we have seen a lot of discussions happening around what we are doing to tackle this information disorder, and how can we well do it. Uh, uh, what are those different stakeholders? What policies should be made? Initiatives, and to some extent, I think we are already we have started working on it. But I want to hear it from you, Shalini, because you also have like a team of journalists who meet people, and also looking at the tech side of things. How do you feel that with all these initiatives and policies that we have put in place, and all the work which we are doing right now, at the level of the consumers, are we seeing the desired results coming in, or are they only at the level of just creating policies, starting initiatives, and it is we are not seeing a cascading effect there of whatever work is being done in the field of misinformation?
So I think that an important question to ask is that when these policies and programs are being designed, are they interacting with communities for whom these policies and programs are meant for? And very often we see that there is a huge gap there. One example that comes to mind is in Chitrakoot district in UP, where Khabal area started and has a team even now and has a strong presence. There was once a government program that was doing surveys to get information from women, and this was a program on women's reproductive and sexual health. So they wanted to do focus group discussions with women in villages. And they happened to come to a village where Khabal area reporters were also present. And the way in which the focus group discussions were happening was that these people arrived and they told somebody in the village to round up women that were pregnant and lactating and bring them to the place where these people were going to conduct the discussion. It was a time of day when women were not available. They had either gone for work in the fields, agricultural work, or had gone to get fuel, wood from the forest, or were generally not available. It was also a place in the village where many women would not go because of various issues related to caste and class, etc. And also the way in which this information of asking lactating and pregnant women to come to this very public place meant that those women were probably not going to come. So that was just an example of how information about women very often is limited to only reproductive and sexual health. Information, when it's shared back with these communities, is in a way which is very problematic, often very didactic, often in a language that people don't understand because it's either the mainstream language or not the local language, and also in a style that is quite alienating. So for all these reasons, while there are programs and policies for communities that are marginalized, that are vulnerable, they're not able to reach those communities. Also, unlike that, misinformation sometimes, and as Osama said, and you also said, Divya, um, it thrives on existing social cleavages. And also it uses a language that is more appealing to people. It works on people's biases and is usually available in formats that are very easy to share. So, videos and reels and blogs and memes can be shared easily, and misinformation is available in these formats and in languages which are very popular. Sometimes, they also jump the literacy barrier. That's more shareable. So if one can think of bridging this kind of gap that exists between policies and programs and the language and formats and styles that are used there, and how people who are spreading misinformation and disinformation are doing that, I think there's probably a lot that we can learn from that.
Indeed, indeed. Thank you, Shalini. And I think while you were listing down all the challenges which we face when we try to follow and try to tackle and find out ways how we can control the spread of misinformation, disinformation, um, I think now it's time that we move to the most asked upon question whenever anyone talks about disinfo is what AI, the artificial intelligence, has done to how it has made it more sophisticated. So I would really want to bring it to you, Tina, because you have been following it for some time, maybe. And in health misinformation, I get asked a lot about uh, is there any research which is being done? So according to you, what you have observed have been the biggest challenges which the advent of artificial intelligence has brought when it comes to tackling misinformation. Also, is it all doomed, or are there not any good things which AI has brought to us? Because that's what they are actually claiming right now. So
Yeah, I mean, anyone that's been reading the news maybe the last 6 months, either AI is the world's wonder or it's the coming apocalypse. But actually, it can be used effectively to promote a healthy information environment, just as much as it can be misused to promote mis and disinformation, and also to make it so much more easier to spread. Now, anyone that's actually working in health communication, basically, I think we're all realizing that a health communicator, one of the essential skills going forward is going to be to effectively use AI. It's a tool, and people that will have the skill to use it for their own work can actually use it better. That's basically the future in communications. But we can't only be talking about being users of it, because there's really no guardrails and no regulation when it comes to technology or AI. So there's two different things. Artificial intelligence as a broad set of different methods that basically is already integrated into our phones, any type of search engine that you use, many social networks for the feed, etc. It already is built in, and it influences the type of information we individually can consume, what we see, etc. There aren't really any guardrails, especially when it comes to the health information promotion when it intersects with AI. And this goes both to regulation of platforms, internet platforms. It goes to regulation of what has been talked a lot about, the generative AI, so use of artificial intelligence to very rapidly produce text or visual images. And the visual is actually even more important, because much more than text, the language of the internet is not text, it's visual, it's video, it's image, it's emojis, interactions. And that's actually quite an issue. One is the regulation, but the other is that we also need to be a much better, and we all need to be a part of advocating for a much more equitable and inclusive governance. There's a lot of discussion globally about this, and we really need to make sure that it's not only the government and the tech industry that are at the table, but actually also the communities, civil society, and in the aspect of health information, health workers. One other point that I wanted to make here, the tech sector is probably the only industry of the 21st century that has been left so unregulated. And this has several effects also globally, because where there is more regulation of the platforms of the information environment, this is where also the platforms invest more money into their public safety and content moderation teams. But this basically leaves easily over 95% of the world having to deal with the impact of that. So low and middle income countries actually were only 3% of Facebook's public safety and content moderation investments, and most of it was in the US and in Europe, because this is where the biggest regulation was happening. And this doesn't even mean that this basically means that also any language that is not English is basically, you don't need to do much to basically look into online forums, and a lot of discussions, hate speech, etc., actually takes place in open, because there really isn't any capacity or guardrail in the online information environment to do this. Now, AI can then, through feeds, through algorithms, propagate that much faster and also encourage spread. And the last point I wanted to make is that humans make artificial intelligence tools, and humans are fallible. So our tools are also fallible. So there's this lots of discussion about bias that is built into artificial intelligence tools. Basically, algorithms are built to reflect the data they were trained on. And that means that all of the bias and non-representation of certain communities in data sets that are used both in image or in narrative, all of that gets reflected back and can be reflected back to users that try to use AI tools that are based on AI. Now, there are initiatives, not yet enough, in my opinion, that really would be looking at equity and countering algorithmic bias in low and middle income countries. There is, for example, distributed artificial intelligence research institutes that deals with this. But there actually needs to be quite a lot more work done on this. And basically, if you reflect on all of this, AI tools, just like any tools, can be used for good or bad. There's different ways that we deal with this in any other tools. What's different with AI is that it requires they're easier to use. They're built to be easier to use, but it actually requires a much more informed and a much more critical user. So this is where, this connects the dots also to the literacies, where actually, if we want to really understand how AI affects the information environment, we need to promote our own and other people's literacy regarding use of AI, its governance, and participate in the discussions.
Thank you so much, Tina. Yes, please, Shalini.
Yeah, I just wanted to add to this, because in the morning during tea time, there was some people who asked the AI question, and I tried to think about it a little bit. So in the context of India, I feel that AI tools, in the way that we've seen, like deepfakes, etc., have not been deployed in a significant way yet, which doesn't mean that they will not be available. It's only a matter of time. So right now, I think it's important to create public awareness about these tools, and how they can blur the line between reality and fiction, and how they can be used, especially around big events. And we have elections coming up, the state elections and also Lok Sabha elections next year. And again, the challenge is not so much in terms of identifying deepfakes. They are still easy to, I mean, I shouldn't say easy, but it's not a big challenge to find deepfakes, but it's challenging to know where they are circulating. So work around that also needs to happen. And I think, yeah, if we can harness technology uh, to work in addressing misinformation and disinformation, that's the kind of stuff that I think we should also focus on. And I know that many groups are already doing that.
Absolutely. Thank you, Shalini. I'm really tempted to ask like more follow-up questions on this, but I've been reminded twice that we are actually running out of time. But I would not want to close this session before asking this very important question, because I really believe that when we have discussions, we should definitely leave with certain action points and certain things which we can work upon. So if three of you quickly can tell all of us that how everyone who's sitting in this room, and also there are stakeholders who are not in the summit right now, be big tech or government and many other, how can we effectively work together as a coalition and uh, involve everyone in combating disinformation? How can we come up with more operational, more substantial and tangible partnerships and work together on combating this? Maybe we can start from Tina.
I'll be very short. I think actually building on the partnership that was just announced after lunch, it's a great start. Bringing practitioners and academics together and civil society, different organizations, and the communities. Because I think the future really is meeting the community's information and service needs. If this is met, the trust is built, it means that also the big challenge of misinformation, any media manipulation that may be in the future ahead of us, we actually have the ties and the trust in order to counter it together much better.
So I have 2 points. One is that media information literacy must be essential at all level as an action point at educational and all kind of level. That's number one. Number two is that everybody should know that India has just got Data Act. I'm in saying short, Data Privacy, whatever Act. And that act simply makes you live in between the data rather than data lives in between the humans, right? And all of you, all of us will become data. Therefore, they will have enough data to create better artificial intelligence to overrule human intelligence. And therefore, it is very essential for all of us to know that what kind of legislations are coming which is actually going to demean you and have been demeaning you. And basically voice yourself in such a way that it's not acceptable. Otherwise, we are giving way to create dehumanizing yourself and allowing somebody else to use you and your data and your information in such a way that can actually come back to you and overrule. And therefore, we are creating an environment of disinformation, misinformation, without having a stake to even call against it.
I think that all of us are trying to work in many ways to address misinformation and disinformation. And if we can think of programs and initiatives that can bring us together, maybe around one event or one theme, so that we can work together, because misinformation and disinformation, as we know, is massive in scale. And often for us to work as individual organizations, institutions, is very challenging, especially for newsrooms, and again, I'm talking about small newsrooms, community-based newsrooms, with limited resources, limited staff. So for people to come together. And I'd like to give the example of one initiative that I worked on as part of Midan. This was last year when there were elections in the Philippines. There was a coalition called Facts First PH. This was a coalition of about 150 organizations that came together around the presidential elections in the Philippines. And the way in which this coalition was structured was that there were 4 layers. The first layer had fact-checking groups and newsrooms who were basically looking at all the misleading information that was circulating online and addressing that by producing fact checks and explainers and other content that was verified and credible. The second layer, which was the largest layer, had civil society groups. This layer was called the mesh. And this layer was involved in then amplifying and distributing the content that was produced by the fact-checking groups. And when they distributed the content, it was in various languages, in different formats, online and offline. So like there were some groups that were doing TV shows on the top 10 fact checks of the week. Some were producing TikTok videos, some were running campaigns with college students. So the mesh was involved in that kind of distribution and also translating content into the local languages in the Philippines. The third layer was the research layer. They were looking at the content that the fact checkers had accessed, the misleading content, etc., and producing research papers on trends of misinformation that people were seeing around the elections. And the fourth layer was the legal layer, which had lawyers and legal experts that were constantly tracking cases of harassment of journalists and activists, and also filing legal cases and lawsuits against actors who were, harassing the other layers. So this coalition functioned together for about 10 months. And it's, a great example for us in other countries and other regions to also take to our own work and, whether it's elections, it's hopefully not a pandemic, but other kinds of crisis where all of us can work together.
Thank you so much. How much time do we have? Okay, so I would like to open. Okay, we have quite a lot of questions. Maybe we can start with yes.
Hello, my name is Dipesh. I have 2 quick questions, one for Shalini and one for Tina. Shalini, is there too much pressure to share correct or fact-check information as an independent news organization while big players have become independent? And how do you prioritize when you run Kabul area or even Medan? Second question for Tina is that in emergencies like COVID, there is misinformation, disinformation about diseases, for example, how you mentioned about measles and the people who are getting in between that. But sometimes organizations themselves come into the wind, and that happened with WHO as well. So how do you handle that? What kind of atmosphere is there, and how is the firefighting done? So just 2 questions for both.
I just want to clarify that Midan is not a fact-checking organization, so we don't produce fact checks. We work with fact checkers. Kabul area, there are 2 members from Kabul area here who can also respond to this. Kabul area doesn't produce fact checks, but one thing that we have always done as part of our work, and now Kabul area is 21 years old, is that verifying information that we get, whether it's from online sources or from people directly in the field, verifying that information, having evidence to back up that information, making sure that our sources of information are valid. That's something that we've always done and continue doing. So fact-checking in the way that fact-checking organizations are doing is not something that Kabul area does yet. But making sure that all the facts are accurate is definitely something that most good and independent newsrooms do.
So at the beginning of an emergency, especially when there's a new disease like there was in COVID, there is a lot of uncertainty. So um, no one can have all of the information at any one time. So it's really important to communicate what you know at the time and what you don't know. And also be honest about this. So sometimes this is very hard. I think actually people, colleagues working in communications know really well about this. What also happens, for example, looking back in COVID, is that at the beginning there was a lot more attention given to debunking information. So working with fact checkers then to identify rumors and then debunk and publish debunks. But then actually as the pandemic protracted, there was a lot more attention given to narratives that started circulating and that were forming, because this was actually what was impacting people's understanding, for example, of changing health guidance, etc. So different phases actually of an emergency does require a little bit different response, but of course it becomes harder as time passes. Different events start bleeding into each other, and we saw this also during the last 3 years. Emergencies started compounding, and this affects our work as well, because people's attitudes into next emergency actually gets formed by their previous experience.
Yeah. Hello, everyone. This is Ajasvi Gupta from Delhi University. Well, I feel like when it comes to data and information, it acts as a distinct form of currency in the neo-colonial world of technological revolution that we live in today. In the sense that misinformation is not only spread inadvertently, but also purposefully by several people, particularly the politicians in charge, leaders, and capitalists for that matter, to yield public opinion in their favor. So when it comes to combating misinformation, we still have a lot of fact-checking platforms like Shalini ma'am's Khabar Lahariya matter. But disinformation, by spreading that, you're actually trying to wire the human brain in a certain way. So how do we plan to combat that, which I feel like is a Herculean problem in itself? How do you combat disinformation in general?
You can take today, please.
Would you like to answer some?
I don't have an answer, but I was just thinking that maybe we can have soon news coming. Under that, there will be a red light and green light and whatever, fact checked. Only read something fact checked, claimed fact checked, rest don't read it or don't consume it. You know, there might be a situation because there are more misinformation than the fact checked information. So we might reach to a point where we can say that fact check is not a post effect, but pre-effect, you know, that it should be applied.
Also, at the same time, I think one issue which we are coming across these days when we talk about fact checking, that we are in times of crisis, we are also coming across fake fact checkers, people who claim to be fact checkers, but they end up creating certain level of bias and adding to the disinformation campaigns. So yeah, but Tina, you would like to add something to it?
30 seconds, please.
Maybe just not to forget that actually most of the conversations about health and people's decisions about their own health are about their questions that they have so that they could inform themselves and make a decision, or concerns they have for themselves and others when they are making that decision. So that means that if we want to prevent that they become vulnerable to misinformation, we need to address the precursors. What makes people vulnerable? When they have questions that are not answered, that their concerns that are not addressed through service or information, and they can't find information in acceptable formats in the languages, etc., that they're looking for. And every single health decision, even if I end up taking my child every year to get vaccinated, I will have different questions. Every single health decision about myself or my loved one literally restarts the cycle of seeking information and making decision. So fact checks won't be the sole countering of this, because it comes down to the person that is interacting, seeking information, and making decision about their health. This is really difficult, and this is what makes health misinformation so much more difficult than misinformation about elections or maybe even climate. But it's very complex because it actually has a societal and personal value-related decision.
Thank you. Thank you so much, Tina. I know we are running out of time already. So thank you, Osama. Thank you, Shalini. And thank you, Tina, for such an insightful discussion on this topic. I think we really need to have one full summit which talks about this disinformation, its impact on the different aspects of humanity, and how can we work on it better and more effectively. So I'm making a pitch for next year, Farad, already with you. But thank you so much.
Thank you,
all of the
Divya.
audience.
Thank you to the panelists.